Good afternoon. Thank you for having me here. So my background actually is PhD biophysics and consumer tech. So I started new businesses at Sony and HP. So the issue about stroke is when you have a stroke or one of your loved ones, you don't really see it as obvious. Like when my father got his first stroke, it was a surprise. And then it always takes a bit of time to really figure out what a stroke is when someone has a stroke. So to discriminate stroke against other conditions is important. What is stroke? Stroke basically happens when you have issues with the blood supply in your brain. So basically this prevents brain tissue from getting sufficient oxygen and nutrients. There are different types of stroke, obviously, which is not relevant in this specific context, but just for awareness creation. So now we understand what stroke is. It comes typically out of the blue when you don't expect it, and it's hard to recognize that someone, for the non-professional, that someone has really stroke. Why is it called silent epidemic? Now, it's called silent epidemic because it happens when you don't expect it. So there's a lack of awareness. And that's something we have to build on, also understanding what causes stroke. And the reasons are that the diagnosis is difficult. Sometimes it's even hard to differentiate that someone has a stroke or it's just a migraine. Or what's also quite kind of a disaster is when female patients have a stroke and the physician thinks it's just a migraine. Not just, but it's a migraine, and that's a big issue, obviously. So basically, the delay in diagnosis leads to more severe consequences. What can we do against stroke? So basically, there is some genetic predisposition, obviously. There are some lifestyle-related aspects. Now, smoking is a classic, right? But obesity, all the many things we don't really realize. Basically, what type of sugars do we have intake, stress, exercise. So basically, what we are talking about is a public health crisis. We basically need to look at it on a population level. Only then we can have an impact. How can we do that? We can raise awareness. We can basically look at how to improve healthcare infrastructures, promote healthier lifestyles, and all this together basically implement better stroke prevention. So as mentioned in the introduction, there's a huge issue of stroke in the MENA region. So there's a worldwide growth of, or let's say increasing rate of stroke, but especially in the MENA region, it's a big issue. But unfortunately, it's not limited to stroke only. Also, other non-communicable diseases, NCDs, are going up. And so basically, that's something we have to address. And we can address stroke and other non-communicable diseases, the avoidance, but also the management of the diseases by using solutions from data science, using digital health-based solutions. That's an article which I've authored in the Forbes Tech Council a few months ago because it's an urgent topic. Now, let's talk about technology, how to solve it. The good news is we are in the age of technology convergence. That means many different technology disciplines are coming all together. Basically, we have the combination of electronics, data science, we have microtechnologies available. This all can now be mastered together to basically define better solutions. And obviously AI has a strong impact. Many different use cases which would have not been addressable 10 or 20 years ago become now real. Most importantly, it becomes also affordable. I will speak to that later. Let's speak about, let's say, definitions. People in industry, they like to speak about Industry 4.0. We all use some sort of IoT devices, I guess, right? Basically, there's an interesting combination or immersion of cyber-physical system. 3D print is a nice example. You create a design electronically, you can print it, then you can suddenly print your digital idea. So there's a blend between the physical and the digital world. This also applies to healthcare. So what we do basically is, in Health 4.0, we converge biology and data. When we look into the history of health, it started basically a few thousand years ago. Ancient times, healthcare was more of an art. It was very exclusive. Sometimes it worked. right? And it was highly personalized. Then, during the Renaissance, over the past few hundred years, medicine became more of a scientific discipline, right? Not just an art anymore, but the access was limited. What we then had, starting from end of World War II, was basically Health 3.0. What we got since the 1950s, I would say, was an amazing standardization, which was driven by industrialization of healthcare solutions. It became highly complex. With that, it became also very expensive. So I lived in the US 13 years, and the healthcare expense in the US are just mind-blowing, about 20% of GDP, not good. And healthcare access is a benefit, which somehow appears to be counterintuitive. Everyone should have access to a basic level of healthcare. Now comes what we call Health 4.0, which is driven by data science and basically the decentralization. The data science aspect makes it first very personal, because I can analyze now many, many data points. Second, at least as important as that, or even more important, it becomes affordable, because it's more cost effective for different reasons I will show briefly. Access can be democratized, because when I have health testing solutions which are enabled by software algorithms, I can make these algorithms available over cloud solutions. Now, the key trends, just to summarize, the key trends shaping healthcare: convergence of technology, electronics, microtechnologies, and data science are merging together. We are all more informed, better informed, right? Especially since the pandemic, we have even a higher awareness of medical information. Changes on the regulatory side are also moving. Now, having an AI tool as a diagnostic is nothing unheard of. It's in the works. And the digital revolution aspect, data science, it's all, and we all talk about generative AI, big topic, right? I think it's all coming together. Now, what we do specifically in order to enable this is we turn analog blood into digital. Why did I choose this title? Because it's somehow intuitive. We all know how blood is. It's somehow wet and sticky, right? Then we turn this into a not wet, not sticky digital version. What I mean by that, we capture the metabolic part of the blood sample. And we use this actually for precision medicine. We basically capture or create a digital twin of the human metabolism. What is the metabolism? When we eat, we digest, things are turned into energy, and then all the different steps we have, thinking, growing, sleeping, these are all metabolic processes. When we are happy, that's a metabolic process. When we eat too much, that's also a metabolic process, right? So basically, the sum of these processes, or the compounds, are called the metabolome. It's the sum of the metabolic compounds in our body. How do we do that? And first of all, why? I think in the past 20 years, we had a tremendous success of the genomic revolution. Since the first human genome got sequenced about 23, 24 years ago, we got now, to some extent, genomics as standard of care in today's healthcare. Now, genomics shows you the potential that someone may become may develop a certain condition. Genomics doesn't tell you that you have today, let's say, Parkinson's. That's something genomics cannot tell you. Same, genomics cannot tell you if you have stroke. Genomics can tell you some sort of prerequisition that you may have some sort of, let's say, predisposition to develop stroke, but it doesn't tell you if you have stroke or not. The complementary modality of genomics is metabolomics. Basically, the real-time phenotype of your today. So the metabolome mirrors the actual real-time metabolic state, and this gives you now opportunities, insights into disease stage. It gives you insights into if treatments are working or not. And there are also some aspects about wellness or lifestyle, which I typically place at the end because that's a tough market to get in. The traditional diagnostics, I think, is well described. At the end of the day, it's about understanding the human physiology as is, but that's, I would say, something which will come in future. But ultimately, we speak about a new approach to really decipher illness and to improve treatment. In today's diagnostics, what do we do? Let's say when we go to a physician, the physician suspects a certain condition, you get a test for 2 or 3 different biomarkers. It's like looking at a forest from the side and you just look at a couple of trees, but you don't see the entire forest. So what about if you would have the ability to look at the entire forest, you see what type of trees, how many trees there are in the forest? That would be amazing, isn't it? So if you do that in healthcare, basically take a blood sample and scan it, capture it, basically look at the metabolites which are present in one measurement, that would be quite interesting, isn't it? Now let's watch a movie about that.
Lifespin only needs 0.5 milliliters of blood and takes only one measurement for all tests. The NMR instrument is the interface between the physical and digital world. The patient's metabolic information is being captured in one single scan with radio frequencies and compared to billions of data points from individual metabolic profiles within moments. The sample partitioning for accessing biomarkers and performing health tests is based solely on algorithms. Lifespin. Take your health in your hands.
So what we have seen is real, so you can visit us in our company headquarters in Regensburg, southern Germany, get your blood drawn, walk with us to the lab. You don't see anyone in the lab. We typically don't have much going on in the lab because it's fully automated. And what exactly do we do? So in the legacy lab testing, you get 5 to 10 milliliters of patient blood. The patient blood is being processed, partitioned, it takes time. It needs a very skilled workforce to handle it, and at the end you get 20 or perhaps 30 different metabolites. Time intense, there's some error rate, and it's somewhat costly, right? It doesn't feel right. What we do is a different physical approach. So it may sound for some of you too good to be true, but what we do is we do not use any optical fluorescence labels or what. So what we do is we take a blood sample, plasma serum, we add a phosphate buffer, very straightforward, very basic, and then we insert it into a nuclear magnetic resonance instrument. You all may be familiar with MRT, imaging body parts. It's the very same physics, just a much stronger magnet than that. And then you basically scan the blood sample with radio frequencies, and then you get basically hundreds of metabolites quantitatively captured simultaneously. It takes a couple of minutes. It's based on standard procedure, standard workflow. So basically you can purchase this instrument. It's a third-party instrument, not related to us. You can collect your own patient blood samples. What you then get is an illegible output, which is interesting for us because this is where our proprietary assets are kicking in. We have developed software which can basically deconvolute, extract the complex information, and turn it into a list of quantitative metabolites to create your digital metabolic profile. So basically you can use it for different use cases. It's always the same workflow. You can use it to determine the healthy baseline. We have, for example, we have digitized 90,000 healthy individuals, men and women, from age 18 to 70 plus, first of all, to determine what is healthy. How does the metabolic baseline for health looks like? Then we have captured in total about 200,000 patient samples across 300 different indications to use it for a general health screening algorithm, to basically use self-organizing maps to understand and to show basically what are non-healthy conditions. And right now we are developing algorithms to recognize prostate cancer. We are in the process of starting prospective study, and we have lots of activities in neurology. And just to show you a general overview, we can also see basically how people age over time. That's a publication in progress. Now, first of all, going back to stroke, this was just a tech excursion to explain to you how we are doing it. Now let's speak again about specific diseases and stroke. What you see here is a view which we call Health Compass. You can basically see instantly if someone is healthy or not. Healthy looks overall green, right? That's pretty straightforward. And if someone is not overall healthy, then we see quite interesting signals, which are all quantitative deviations from the healthy range. That means we can see things like kidney failure, like obesity, or also stroke. What exactly do we see? So we see basically a significant change of metabolite concentration. So this is not an esoteric pattern. You can always go back to the raw measurement data and look it up quantitatively what exactly had been measured. So it's not voodoo, it's just basic measurement science. But obviously catalyzed by AI to deal with the plethora of data. When you have stroke, I mentioned earlier that sometimes a migraine is being misdiagnosed, or that a stroke is being misdiagnosed as a migraine, very big issue. And here we are developing algorithms. That's a partnership among other hospitals, also the Charité Hospital in Berlin, where we are basically discriminating different disease states. On one hand, to discriminate healthy individuals versus patients with stroke has an AUC value of 0.98. That means the closer to 1, the more certain it is. Looks really good. So it's somewhat straightforward to discriminate people with stroke and not stroke, and being healthy. But then when you look at a migraine versus stroke, also quite interesting, we can discriminate this to some extent. This is obviously work in progress, but these are tools to basically assess if a patient had stroke, migraine, or perhaps another neurological condition. What exactly do we see? Your eyes are perfectly fine. I did blur this for IP reasons. So what we basically see are basically metabolites which show deviations compared to the healthy range. What's interesting is we see strong deviations in amino acids. Amino acids are being used as an indicator for general well-being. When you can look up, there are interesting studies about long COVID patients, for example, from 2020, where it has been shown that the degree of recovery from long COVID correlates to the recovery of normal healthy amino acid levels, which is very interesting. So basically, we see in different diseases different changes of different amino acids. That's why we decided to first launch an amino acid panel, which basically tells you the quantitative difference if you have a deficiency or excess, which can give you different insights. Obviously, it can give you insights about stroke or other NCDs. So basically, it's a panel of 26 different amino acids, and we launched this last month, actually, and the workflow is always the same because most of the work is happening in silico. Now, what we basically do is, on one end, I've invited you to Germany, basically. We do these testing in-house, but we can basically also scale this globally with local partners who have these instruments and can basically use our software to perform this type of diagnosis. That means it will be operated as a software as a service. Now, what's important is to understand what exactly we are doing, because in the conventional diagnostics, you have the workflow. Patient goes to the provider, provides a blood sample, the blood is getting analyzed for one or the other condition, then you get the result, yes, no, end of the story. This is where our story begins, because what we can do is we can now, because the metabolic profile is digitally already available, now we can unlock additional algorithms, which are additional monetization events, basically, to look at liver condition, for example, kidney condition, lipid panel, or other conditions. So basically, we can have some sort of an inner purchase model for patients and providers. We work with many different hospitals, but I did explain this to you to show the potential of using software, scalable software, as a diagnostic solution on a population level. Now let's go to the global challenges in healthcare, which is related to populations. So we have megatrends, worldwide megatrends, which is on one hand aging demographics, which leads also to the increase of stroke, cardiovascular and neurological diseases. So there's an increased demand for NCD diagnostics globally. At the same time, the rise in healthcare expenditure GDP is a nightmare. Some people may like it because of market growth, but that's short-sighted because at the end of the day, someone has to pay, and that's typically us. So the taxpayer, right? So basically, how can we balance the high cost of diagnosis against accessibility and health equity? That's the key question. Now, I've shown you now what kind of technology solution we have to tackle basically diagnostics on a population level, health management. Now, my question is to you, how much do you think does it cost to screen with our technology 1 million people per year? So I'd like to hear some numbers from the audience. Just shout it out. How much would it cost to use this technology, which I've shown you, to test 1 million people basically per year for different types of conditions as shown? Or even the general condition, is someone healthy or not, or has some sort of an NCD? Any numbers, any ideas? Now I can say it's single digit in this range, okay, so it's really low, which, say again? Yeah, that's about right. And that's interesting. Why is that? And why do I speak about cost? Because I want that precision medicine becomes affordable and scalable across populations. What I don't want to have is a precision medicine tool which you can only access at Stanford Hospital or Mass General. This doesn't help, right? And that's why the question is, how can we bring this to attention, that primary care providers are enabled to prescribe these type of testing, or that you can even think of government-level programs or corporate health programs. That's why it's really important, I think, to be open about the cost, because if you can reach everyone, even at low cost, it can be highly interesting as a business. That's also my consumer technology thinking. What we ultimately want to have is to implement AI for affordable healthcare. Because the healthcare system as it is in a huge crisis. It's horrible. AI could help to do a better job here. There's actually a study from the Harvard T.H. School for Public Health. Actually, it's a pretty new study from this year, that AI could improve health outcomes and reduce treatment cost by 50%. That's a lot, right? And just if you improve diagnostics, access to care, and enabling precision medicine. Just to show you again what we have, what we do. We basically digitize blood. We need up to 10 times less sample than the standard of care. It's much less expensive than standard of care. It's faster. When you visit us in our lab, you get your blood drawn. You can watch how your blood is being scanned. Takes a couple of minutes. Then you can watch how it's being processed, and you get your result printed out in a couple of minutes after that. It gives you much more data. And our interest is basically to scale with partners globally. Because when we have the like-minded partners, which are early adopters, obviously, then this can be extremely exciting. And one of our board members is Nobel laureate. He also confirms or supports our thesis that almost all diseases are linked to the metabolism. It means when we have a window which is looking into the metabolism, then we have a window which looks into the health condition of an individual, and this is highly scalable. Thank you very much.